In 1987, tens of thousands of people gathered in Saudi Arabia for the annual Hajj pilgrimage. But what started out as a celebration led to a health crisis. Just a few days after the pilgrimage, more than 2,000 cases of meningitis broke out, spreading across Saudi Arabia and the rest of the world. The outbreak was so fierce that it was believed to have sparked a wave of deadly meningitis epidemics that ultimately infected tens of thousands of people worldwide. Meningitis is the inflammation of the meninges, 3 tissue layers responsible for protecting the brain and spinal cord. What makes meningitis so dangerous compared to other diseases is the sheer speed with which it invades a person's body. In the worst cases, it causes death within a day. Fortunately, that's rare for patients who receive early medical treatment. The disease primarily comes in 3 forms: fungal, viral, and bacterial, the last being the most deadly by far and what we'll focus on. People usually contract bacterial meningitis by breathing in tiny particles of mucus and saliva that spray into the air when an infected person sneezes or coughs. It can also be transmitted through kissing or sharing cigarettes, toothbrushes, or utensils. Some people can be infected and carry the disease without showing symptoms or getting sick, which helps the disease spread quickly to others. Once the bacteria enter the nose, mouth, and throat, they cross the surrounding membranes and enter the bloodstream. From there, bacteria have rapid access to the body's tissues, including a membrane called the blood-brain barrier. This is made of a tight mesh of cells which separate blood vessels from the brain and block everything except for a specific set of particles, including water molecules and some gases. But in ways that scientists are still trying to understand, meningitis bacteria can trick the barrier into letting them through. Inside the brain, the bacteria swiftly infect the meninges. This triggers inflammation as the body's immune response kicks into overdrive, bringing on fever and intense headaches. As swelling in the meninges worsens, the neck begins to stiffen. Swelling in the brain disrupts its normal function, causing symptoms like hearing loss and extreme light sensitivity. As pressure increases in the cranium, it may also make the person confused, one of the hallmarks of the disease. A few hours in, the rapidly multiplying bacteria start to release toxins, leading to septicemia, also known as blood poisoning. This breaks down blood vessels, letting blood seep out and form what starts out looking like a rash and evolves into big discolored blots beneath the skin. At the same time, those toxins burn through oxygen in the blood, reducing the amount that gets to major organs like the lungs and kidneys. That increases the chance of organ shutdown, and alongside spreading septicemia, threatens death. That all sounds scary, but doctors are so good at treating meningitis that a visit to the hospital can drastically reduce an adult's risk of dying from it. The longer it's left untreated, though, the more likely it will lead to lasting damage. If declining oxygen levels cause cell death in extreme parts of the body, like fingers, toes, arms, and legs, the risk of amputation goes up. And if bacterial toxins accumulate in the brain and trigger cell death, meningitis could also cause long-term brain damage and memory loss. So fast treatment, or better yet, prevention, is critical. That's why most countries have vaccines that defend against the disease in its deadliest forms. Those are usually given to the people who are most at risk, like young children, people with weak immune systems, or people who gather in large groups where an outbreak of meningitis could potentially happen. In addition to those gatherings, meningitis is most common in a region called the Meningitis Belt that stretches across Africa, though cases do happen all over the world. If you're concerned that you or someone you know may have meningitis, get to the doctor as soon as possible. Quick action could save your life.
Meningitis is an inflammation of the tissues responsible of protecting the brain, which are the dura mater, arachnoid and pia mater, and spinal cord caused by bacteria or viruses. Meningitis can be the primary reason a patient is hospitalized or can develop during hospitalization and is classified as septic or aseptic. Septic meningitis is caused by bacteria. In a septic meningitis, the cause is viral or secondary to lymphoma, leukemia, or human immunodeficiency virus. The bacteria Streptococcus pneumoniae and Neisseria meningitidis are responsible for 80% of cases of meningitis in adults. Haemophilus influenza was once a common cause of meningitis in children, but because of vaccination, infection with this organism is now rare. In meningitis, meningeal infections generally originate in one of two ways: through the bloodstream as a consequence of other infections, or by direct spread, such as might occur after a traumatic injury to the facial bones or secondary to invasive procedures. Neisseria meningitidis concentrates in the nasopharynx and is transmitted by secretion or aerosol contamination. Bacterial or meningococcal meningitis also occurs as an opportunistic infection in patients with acquired immunodeficiency syndrome. Once a causative organism enters the bloodstream, it crosses the blood-brain barrier and proliferates in the cerebrospinal fluid. The host immune response stimulates the release of cell wall fragments and lipopolysaccharides, facilitating inflammation of the subarachnoid and pia mater of the meninges. Because the cranial vault contains little room for expansion, the inflammation may cause increased intracranial pressure. Cerebrospinal fluid circulates through the subarachnoid space where inflammatory cellular materials from the affected meningeal tissue enter and accumulate. Major types of meningitis include viral and bacterial meningitis. Viral meningitis is the most common type of meningitis and is often less severe than bacterial, and most people get better on their own without treatment. However, bacterial meningitis is very serious and can be deadly. Death can occur in as little as a few hours. Permanent disabilities such as brain damage, hearing loss, and learning disabilities can result. According to the Centers for Disease Control and Prevention, meningococcal disease is found worldwide, with the highest incidence of disease found in the meningitis belt of sub-Saharan Africa. In this region, major epidemics occur every 5 to 12 years, with attack rates reaching 1,000 cases per 100,000 population. Other regions of the world experience lower overall rates of disease and occasional outbreaks, with annual attack rates of around 0.3 to 3 per 100,000 population. The World Health Organization also introduces Defeating Meningitis by 2030 in May 2018 at the World Health Assembly by Eastern Mediterranean and African regions. This includes access and monitoring of cases through prevention and epidemic control, diagnosis and treatment, disease surveillance, advocacy and information, and support and aftercare for survivors. However, in the Philippines, the Department of Health stated that a total of 778 suspected cases were reported from the selected Sentinel sites from January 1 to August 5, 2017. For the clinical manifestations, headache and fever are frequently the initial symptoms. Fever tends to remain high throughout the course of the illness. The headache is usually either steady or throbbing and very severe as a result of meningeal irritation. This results in a number of manifestations such as nuchal rigidity, which is a stiff and painful neck and can be an early sign, and any attempts at flexion of the head are difficult because of spasms in the muscles of the neck. Positive Kernig sign. When the patient is lying with the thigh flexed on the abdomen, the leg cannot be completely extended. Positive Brudzinski sign. When the patient's neck is flexed, flexion of the knees and hips are produced. When the lower extremity of one side is passively flexed, a similar movement is seen in the opposite extremity. Brudzinski's sign is a more sensitive indicator of meningeal irritation than Kernig's sign. Photophobia is also seen with an extreme sensitivity to light. A rash can be a striking feature of Neisseria meningitidis infection, ranging from a petechial rash with purpuric lesions to large areas of ecchymosis. Confusion, Disorientation, memory impairment, and behavioral manifestations are common in the early course of the illness. As the illness progresses, lethargy, unresponsiveness, and comatose may develop. Seizures can also occur as a result of areas of irritability in the brain. The initial signs of increased intracranial pressure include decreased level of consciousness, fever and vomiting, and focal motor deficits. If this is not controlled, the uncus of the temporal lobe may herniate through the tentorium, causing pressure on the brainstem. Brainstem herniation is a life-threatening event that causes cranial nerve dysfunction and depresses the centers of vital functions such as the medulla. And that ends my report for meningitis. This is Diane Dolina. Thank you for listening and have a great day.